It is my great honor to introduce our first speaker, Roland Griffiths, who will open this conference with a keynote lecture on the Johns Hopkins Psilocybin Research program, which he heads. And I think this program encompasses many of the directions that psychedelic research is and has been taken for the last couple of years, or even since the beginning of research into psychedelics. I think there would be few people more suited to open this conference.
Several recent analyses from the National Survey on Drug Use and Health in the United States, this is a large epidemiological database, show that the classic hallucinogens are not independent risk factors for mental health problems. And other recent analyses suggest, in fact, that the classic hallucinogens as a group and psilocybin alone specifically may have protection with respect to psychological distress and suicidality. However, despite the low abuse potential and the low risk of harm, there still remains concern about non-medical use because of potential adverse effects. And these include panic reactions, possible precipitation of enduring psychiatric illnesses, and long-lasting visual perceptual disorders. So consistent with this concern, we recently conducted internet survey, large-scale internet survey, asking people to tell us about their most challenging experience after having taken psilocybin. So to be admitted into this survey, this was an anonymous internet survey. People had to say they had a challenging or difficult experience with psilocybin, and then they were asked to fill out the survey based on their most challenging experience, their worst bad trip, if you will. So this is not a random sample. This is explicitly inquiring of people who have had difficult times with psilocybin. Tell us about the very worst time you had. So the participants were 1,993 people, mean age 30 years, males and whites overrepresented. About almost 40% were daily cannabis users. They were highly educated, 51% college grads, and geographically dispersed, 66% from the US, about 60 different countries represented. The people had modest prior use of psilocybin before the designated experience, so 2 to 5 times. So these were not people who had excessive experience. The designated psilocybin experience occurred on average 7 years before the survey was completed. So on average, the people were about 23 years of age. For those who knew, the dose of dried mushrooms was about 4 grams, and for fresh mushrooms it ranged between 21 and 30 grams, which we estimate to be approximately 20 milligrams of psilocybin, comparable to what we give in our studies. That's a moderate high dose range of psilocybin, but we've gone significantly higher than that. So this slide shows the duration of the challenging experience, and it's rated here on a scale from starting at 10 minutes duration up to 30, 60, 1 to 2 hours, greater than 2 hours, the entire session. So notably here, about 40% of this group said that the duration was 2 or more hours, which if you think about it is actually a long time to be stuck in one of these very difficult experiences. And now this shows how difficult or personally challenging was this experience. And this is rated now on a scale like an everyday challenging experience, once a week, once a month, once a year, once every 5 years. Top 10, most difficult of your life, top 5, single most. So 62% said it was in the top 10 or greater most challenging experiences of their life. And it was almost 40% that said it was in the top 5. So this stands out to people as a dramatically difficult point of their life experience. So the degree of difficulty of the experience was greater at higher psilocybin doses, which makes sense, and we've shown in the laboratory, younger age, absence of physical comfort or support, absence of social support, worse emotional state before ingestion. There was some evidence that on average, cannabis use before or during the session was slightly negatively associated with the difficulty. However, written comments suggested that cannabis use sometimes significantly exacerbated challenging experiences. So I think the case about whether cannabis is useful or a hindrance remains open. Now this slide shows how personally meaningful was this experience. Again, the scale is just like the difficult experience, going from everyday to single most personally meaningful. And 60% of this group is also saying that this is in the top 10 most personally meaningful experiences of their lives. So that's curious. There seems to be a paradox there. So it's among the most challenging, among the most personally meaningful. Multiple regression analysis showed the degree of difficulty of the experience actually was positively and significantly related to personal meaning, spiritual significance, and well-being. And so this would appear counterintuitive, unless you think of it as a cathartic kind of experience. And it is consistent with clinical observations that sometimes resolution of psychologically challenging experiences may result in attribution of positive effects. Now, in contrast to the degree of difficulty, the duration of the challenging experience was negatively related to personal meaning, spiritual significance, and well-being. So the longer the difficult experience, the less likely there were to be positive attributions to the experience. And so these findings then suggest that therapeutic interventions of challenging experience should be preferentially aimed at reducing the duration rather than the peak difficulty of the experience. And I think that's what the harm reduction groups do in festivals, like Burning Man, the Zendo Project. It's about providing comfort and support, significantly reducing duration of difficult experience. Okay, so there were some very noteworthy adverse events that respondents attributed to the experience. So 11% of this group reported that they put themselves or others at risk for physical harm during the experience. And factors that statistically contributed to that were the dose, the degree of difficulty, the duration of difficulty, absence of physical comfort, and absence of social support. 3% of this group reported behaving in physically aggressive or violent manners during their experience. 3% got help at a hospital or emergency department. 8% reported decreased sense of well-being or life satisfaction after their experience. So not everyone came away from this experience with positive effects. Now, of those whose experience occurred greater than a year before, and this is about 70% of the group, 10% reported adverse psychological symptoms that lasted more than a year, and 8% sought professional help for symptom treatment. So people are, some group of these people are seeking out professional help. Respondents who reported having been treated for psychological symptoms before their challenging experiences were more than twice as likely to seek treatment services after their experience than those who had never received psychological treatment. We don't quite know how to interpret this. This is either these people have increased vulnerability to difficult experiences, or they're more familiar and treatment services are more accessible to them. Inspection of the data and review of open-ended comments. So this survey had an opportunity for open-ended comments, and some people literally wrote pages. I think we have a couple thousand pages of comments from the whole survey. But investigation of those indicated that these challenging experiences were associated with the onset of enduring and impairing psychotic symptoms in 3 cases, and attempted suicide in 3 cases. So just stepping back, these adverse outcomes are consistent with what are rare reports in psychedelic users of engaging in dangerous behaviors, receiving acute medical care, seeking out psychiatric treatment. However, it's very important and noteworthy that these types of adverse events are very uncommon in structured laboratory settings in which psilocybin participants are carefully screened, they're prepared, they're supported before, during, and after sessions. Okay, so the Psilocybin Research project at Johns Hopkins, we initiated our first study in 1999. We've completed 3 studies in healthy volunteers, 4 large-scale internet surveys, one of which I just described to you. We've done a study in psilocybin treatment of psychologically distressed cancer patients, and I'll present some of those results. A pilot study of psilocybin-facilitated cigarette smoking cessation. And our ongoing trials include a controlled trial of cigarette smoking cessation. This is a randomized trial. And then we're looking at the effects of psilocybin in long-term meditators, religious professionals, and we're conducting some additional internet surveys. To date, we've treated about 260 participants in over 550 psilocybin sessions, so we've accumulated a good deal of experience. So I want to review the studies in healthy volunteers because they're germane to the treatment application studies. And to do this, what I'm going to do is collapse data across all 3 studies because the major results I want to underscore are really similar. They represent, in some respects, systematic replications. So we did 1 study with 36 participants receiving a high dose of psilocybin or a high dose of methylphenidate, another study in 18 participants who received a range of doses of psilocybin, and then a study in 75 participants who had 2 or 3 doses, and they received a low dose of psilocybin, or some of them did, very low dose, 1 milligram, or 20 or 30 milligrams of psilocybin. So volunteers in all of these studies were recruited from the local community through flyers and newspaper advertising. The participants were medically and psychologically healthy. Most were without histories of any hallucinogen use. And we did this intentionally because we didn't want to bias the population toward those people who had had good experiences with psychedelics and then would affirm those experiences. It also gives us information about base rates of difficult experience in naive people. So 129 participants in all, mean age 44, 60% female. This is a highly educated population, 92%. Employment, 80% full-time, the rest part-time or semi-retired. These were high-functioning professional groups of people. The volunteers met with our monitors or our guides before sessions and after sessions, and they did this on several occasions before the first session under the rationale that building trust and rapport minimize the risk of adverse effects to psilocybin. Studies are conducted in a comfortable living room-like environment. Volunteers come into our unit at 8 in the morning, swallow a capsule. There are 2 guides or monitors present throughout the session. This is Bill Richards, incidentally, who you'll hear from later. The volunteers are encouraged to lay on the couch, use eye mask and headphones through which they listen to a program of music, and they're encouraged to direct their attention inward on their inner experience. If fear or anxiety arise, then the guides or the monitors are there to provide reassurance. So this shows the time course of monitor ratings in the dose effect study. And I show this to show the orderliness of this data. I've done a lot of drug research in my life, and rarely do I get something as beautiful as this in terms of the order of doses and time dependence. So this is ratings of magnitude of overall drug effect as a function of time across the first 6-hour period here. Onset occurs at 30 minutes, peak effects at 2 or 3 hours, and decreasing toward baseline levels thereafter. So not surprisingly, under these conditions, when you give psilocybin, a classic hallucinogen, we get perceptual changes like visual illusions, greater emotionality like increased sense of joy or peace or contentedness, and less frequently, but it does indeed occur, fear and anxiety. There are also cognitive changes, sense of meaning, sometimes suspiciousness emerges. But to me, the most interesting effect, and one that we've pursued and really I want to highlight throughout this presentation, is that in most volunteers, psilocybin under these conditions produced large increases on self-rated questionnaires designed to measure naturally occurring mystical type experiences. These are experiences reported by religious figures throughout the ages. And this slide just shows from the dose effect study nice dose-related increases on the mystical experience questionnaire when this questionnaire is given immediately post-session. So what is a mystical experience? In fact, the phenomenological dimensions have been well described prior to this research. We've actually now developed psychometrically valid instrument to measure these. But just descriptively, the dimensions of this experience are these. The core feature is this sense of unity, this interconnectedness of all people and all things, the sense that all is one, pure consciousness. And that's accompanied by a sense of sacredness or reverence. There's a noetic quality, a sense of encountering ultimate reality, a sense of the authoritative truth of these experiences that emerges. Deeply felt positive mood, sometimes experienced as universal love, joy, peace, transcendence of time and space, present or past and future collapse into the present moment. Space becomes endless, the void. And they're often characterized as being ineffable. One of the first things people say at the end of these sessions is they can't possibly put it into words. Now, by the end of the psilocybin session, the acute effects of psilocybin have totally resolved. It's a relatively short-acting compound. The feature that's so interesting is that the memory of these experiences endure. So this is now 1 month after sessions, and we're asking people to do various ratings. And you can see that about 80% say it's in the top 5 most personally meaningful experiences of their lives, comparing it to the birth of a child or death of a parent. Over 83% are saying it's in the top most spiritually significant experiences of their life. 94% increased sense of well-being or life satisfaction, moderately or very much. About 90% endorse positive behavior changes. So that's 1 month. And this shows the kinds of adjectives that people are endorsing to affirm positive attitudes about life and self. So people are saying of these experiences, they have an increased sense of personal authenticity, playfulness, creativity, mental flexibility, self-confidence, increased life meaning, appreciation, richness, positive values, and trust. And likewise, the positive changes in emotion occur, and people are endorsing here increased love and open-heartedness, inner peace, joy, inspiration, decreased sadness and depressed mood, anxiety, anger, and guilt. And this, incidentally, the decreased depression and anxiety relates directly to some of the therapeutic applications. That was 1 month. Now here's 14-month follow-up, and that's as far as we've gone in follow-up, but my impression is that these, if we end up doing further follow-up, these effects are sustained. But here is the endorsement of increased personal well-being or life satisfaction. This is the low dose of psilocybin and the high dose of psilocybin. So you have this is being endorsed by 94% of the volunteers 5 weeks after high doses of psilocybin, and this is maintained at 14 months. This shows an interesting relationship between the mystical experience as measured immediately after the session and the prediction of positive outcome 14 months later, in this case, predicting the spiritual significance of the experience. So this panel is showing this is mysticism score right after sessions. This is spiritual significance over a year later, 14 months. You can see there's a strong correlation. So there's something about what's captured in that mysticism scale that's predicting long-term positive attributes. This is not does not occur with simple intensity of the psilocybin experience. So it has something to do with the qualitative nature of this experience. We also interviewed friends, family members, colleagues at work to see if we could validate the kinds of changes that people were reporting personally. And indeed, we did. In this study, this is just showing that at 1 month follow-up and 14-month follow-up, the community observers are showing changes of the same type or analogous to what the volunteers are reporting. So this is in their own words. At 14 months, what is it that people are remembering? This is one person. The part that continues to stick out for me was the knowing, seeing, and experiencing with every sense and fiber of my being that all things are interconnected. The sense that all is one, that I experience the essence of the universe, and the knowing that God asks nothing of us except to receive love. And another one, the feeling of no boundaries, where I didn't know where I was, where I ended, and my surroundings began. Somehow I was able to comprehend what oneness is. So, soberingly, in spite of the selection and preparation and support we provide, about 1/3 of our volunteers at our very highest dose of psilocybin, that's 30 milligrams per 70 kilogram, none after placebo or methylphenidate, reported strong or extreme ratings of fear sometime during the session. The fear and anxiety had an unpredictable time course of onset and duration. So this really underscores the importance of having that social support and the rapport and trust with the monitors or guides. About 25% of our volunteers had some mild, transient, paranoid thinking, ideas of reference sometime during the session. However, and this is the most important point, despite these struggles, most participants rated the overall experience as having personal meaning and spiritual significance. And no volunteers from our Healthy Volunteers group rated the experience as having decreased their sense of well-being or life satisfaction. So under appropriate conditions, we don't need to have the adverse events that occur rarely, but sometimes under uncontrolled conditions. So what can we conclude from the healthy volunteer studies to date? So psilocybin can be administered safely. Psilocybin can occasion mystical experiences in the majority of people studied. And these studies, and I didn't go into it, provided significant controls for expectancy effects. These effects are dose-dependent, specific to psilocybin versus active psycho control. They're rated as profoundly personally meaningful and spiritually significant, produce enduring positive changes in attitudes, moods, and behaviors. So there are many different directions that research can go, and I'll return to this slide at the end, but what I want to do now is transition into potential therapeutic applications. Are there therapeutic benefits to such experiences? And I'll present data from two, in a cancer trial and then smoking cessation trial. So anxiety and depression is a significant problem in cancer patients. It often leads to a very negative impact on quality of life. Existing pharmacological and psychological treatments are really quite limited. There's some existential psychotherapy approaches that have some value, but by and large, we don't have very good interventions for this kind of distress. Several promising trials were conducted in the 60s and 70s with LSD and another classic hallucinogen. And Charlie Grobe and Alicia Danforth, who is also going to be presenting at this meeting, did a pilot study with a moderate dose of psilocybin published in 2011. So the goal of this study was to determine the efficacy of a moderately high dose of psilocybin. And this is 22 milligrams per 70 kilograms. So in our dose effect study, this is on the high intermediate range when administered under supportive conditions to patients with a life-threatening cancer diagnosis and clinically significant anxiety and depression. So it's a randomized, double-blind, crossover design examining the effects of psilocybin dose, high versus low, on various outcome measures. Mean age, there were 51 participants who completed at least one session. Mean age, 56. About half female, highly educated again, predominantly Caucasian. 45% had some lifetime history of hallucinogen use, but on average this was 31 years ago. So these were not people who had current ongoing use. Medical prognosis at the time of diagnosis, 65% had recurrent or metastatic disease, 35% possibility of recurrence. The types of cancers were varied. We didn't select any given type of cancer. It just had to be a form of life-threatening cancer. This slide shows the DSM psychiatric diagnoses and prior treatment. So 37% had fulfilled criteria for depressed mood, 31% for anxiety, 31% for mixed anxiety and depression, and about half had received prior medication treatment for anxiety and depression. Recruitment was through flyers, newspapers, and internet advertisements. We telephone screened 566 people, 83 in person, 56 started the study, 51 completed at least one session. And this just outlines the study design. So this is a randomized, double-blind, crossover design investigating both the acute and the sustained effects of a very low dose, 1 milligram of psilocybin, which is essentially placebo, versus a moderately high dose of 22 milligrams per 70. The blinding conditions were designed to minimize expectancy bias, and I won't go into those details, but we put some considerable effort into not having these effects driven entirely by expectancy. Total participation time was approximately 9 months. 2 8-hour psilocybin sessions occurred about 5 weeks apart. So after screening, people were randomized to 2 groups. This group gets the high dose of psilocybin first, 5 weeks later a low dose of psilocybin, and they're followed up at 6 months. This just flips the order, low dose first, high dose, and then follow-up. So there were no serious adverse events attributable to drug administration. 3 of the participants died due to cancer-related illness before the 6-month follow-up. This shows that within session time course of observer raters, similar to what I showed you for the dose effect study. So again, we're getting peak effects at 2 to 3 hours and tapering off. The low dose of psilocybin here is showing much greater effects than our placebo dose in that other study, and this has to do with those expectancy controls. People knew they were getting psilocybin. They didn't know what dose they were going to get. They were told, as were the guides, you know, go for it. Make everything you can out of this experience. So this shows mystical experience scores post-session, showing that the high dose, expectantly, produces much greater elevations in mystical experience. And this shows attribution of meaning, spiritual significance, and well-being. So in the left-hand panel here, we're looking at percentage of volunteers showing, endorsing that this experience is in the top 5 most meaningful experiences of their lifetime. So this is 5 weeks after the low dose, 5 weeks after the high dose. Here's 6 months follow-up after this high dose. And you can see these effects are sustained. So there's a very specific effect of psilocybin, and these effects are sustained. This is shown for spiritually significant and increased well-being and life satisfaction. Okay, now what about our clinically relevant measures? So this is depressed mood as measured on the HAM-D scale. This is a gold standard clinician-rated measure of depression. And the left-hand panel here is showing clinically significant improvement, which is defined as 50% reduction in symptom scores. This is 5 weeks after the low dose. It's 92% after the high dose. This is 5 weeks. And these effects are sustained. 79% at 6 months are continuing to show clinically significant improvement on depressed mood. Now this is showing remission to the normal range. So to get into this category, scores on the HAM-D have to be 7 or lower, which is considered in normative range. So here you can see high dose, we have 60% remitting to normal range 5 weeks after. This actually increases somewhat at 6 months. So virtually identical pattern of results are shown for the HAM-A. That's another clinician standard rating for assessment for anxiety now. And so we have 83% showing clinically significant improvement at 6 months. 63% have remitted into the normal range. This just says that in addition to the HAM-A and HAM-D, we gave a variety of other measures assessing anxiety, depression, quality of life, optimism, and all these measures show the same kind of pattern of results. In addition, we did community observer ratings of positive changes, and those too showed sustained effects at 6 months. This now is showing this relationship once again between the post-session mystical experience score and outcome measures, including personal meaning and the therapeutic efficacy. So the x-axis here is showing total mystical experience score. This is immediately post-session, and these are follow-up ratings at 5 weeks post-session. And you can see there's a correlation once again on meaningfulness, spiritual significance, but importantly on the therapeutic outcome measures, anxiety and depression as well. So again, there's something that's being captured by this scale post-session that's predictive now of therapeutic efficacy. And this is the cancer patients in their own words. The seemingly big issue that take up so much of my mental real estate are insignificant. Even when I posed the mental question about cancer, it was irrelevant. Here's another person, deciding to go with life, embrace life, realizing that I had accepted death, but I had not accepted life. I realized that I was glad to be alive. I've always thought I wouldn't be able to feel that. A profound shift in the despair was not the truth, that the part of me capable of finding the light remained. So as you might infer, these are very moving studies to conduct, and the kinds of outcomes that we see are profoundly moving. And Alex Belzer will be presenting some qualitative research in a parallel study done at NYU describing at the more personal level what these kinds of changes were. So the conclusions here: a single moderately high dose of psilocybin, when administered under supportive conditions to carefully screened and prepared participants, can indeed produce substantial and enduring, like 6 months, decreases in depressed mood and anxiety in cancer patients. Steve Ross and Jeff Gus. Jeff is also here and will be presenting work from NYU. Have shown very similar effects in a recently completed study. The Hefter Research Institute and the USONA Foundation have recently initiated communication with the FDA, that's our Food and Drug Administration in the United States, trying to investigate the possibility of undertaking a phase 3 multi-site clinical trial, which is really the first step for regulatory approval of psilocybin as a medication. So let me turn now to psilocybin facilitation of addiction treatment. So we can understand why psilocybin might have efficacy in cancer patients who are psychologically distressed. Why would we think that it should have be of value in treatment of addictions? Well, there are a couple lines of evidence. Anthropologically, ceremonial hallucinogen use is associated with decreased addictions. This is from the Native American Church. Research from the 50s through 70s with LSD suggested decreases in alcoholism. Those studies were mixed. There's been a recent pilot study by Michael Bogenschutz, though, that seems to confirm that. When we initiated these studies, we were interested in looking at cigarette smoking because it's not encumbered by the medical and psychosocial degradations that we see with severe alcoholism or other forms of drug dependence. And we have conducted an internet survey, and in that internet survey we identified 137 long-term dependent smokers who reported complete and sustained abstinence from tobacco smoking that they attributed to a psychedelic experience. Interestingly, when comparing it to previous quit attempts, they said there was less craving. And the other curious piece is only 12% of this group had the intention to quit. So this came on them spontaneously. They had an experience and found themselves walking away from cigarette smoking. So that's the target that we sought to look at. This was facilitation of smoking abstinence by psilocybin. We used cognitive behavioral therapy for smoking cessation, and we integrated that with our standard psilocybin preparation and support. We had up to 3 sessions, the first of which with psilocybin corresponded to the target quit date, and that was a moderate high dose of 20 milligrams per 70 kilogram. And then there were 2 subsequent sessions, one 2 weeks later, one 8 weeks later, at a higher dose of psilocybin. 15 participants, mean age 51, 10 male, 5 female, mean cigarettes per day 19, years of smoking 31, and previous quit attempts 6. And this shows this shows urinary cotinine across the study weeks. This is median cotinine level in the 15 volunteers. So as they're acquiring the cognitive behavior therapy, they're not asked to quit smoking. You can see mean urinary cotinine is running high. They hit the target quit date, which corresponds to the first psilocybin session, and boom, medium levels are down to 0. At 6-month follow-up, we have 80% abstinence rates, which is really a remarkable number in the smoking cessation world. But the best you can do with the very best treatment for varenicline is 30% or 35%. This shows this curious correlation once again between the mystical experience, in this case, predicting decreased smoking craving at 6 months. So this is only 15 volunteers, but again, there's a regression there that suggests something's going on with that mystical experience, or at least how it's reported at the end of the session. So this work is proceeding now to randomized clinical trial. So the overall conclusions here is that with careful screening and preparation, and when sessions are conducted in a comfortable and well-supervised setting, moderate and high doses of psilocybin can be administered safely. Under the conditions of these studies, psilocybin occasioned discrete experiences having marked similarities to classic mystical type experiences reported by religious figures throughout the ages. These experiences are associated with persisting positive changes in attitudes, moods, and behavior. But an important implication is this: the finding that psilocybin can occasion in most people studied mystical type experiences virtually identical to those that occur spontaneously or naturally suggests that such experiences are biologically normal, and that now, for perhaps the first time, these kinds of experiences, call them mystical, transcendent, whatever, are amenable to systematic, prospective scientific study. So, returning to this slide, there's so many different directions to take this work. It's just remarkably exciting. So we talked about some therapeutic applications, and there are certainly others, but there are other very interesting, important questions to be asked. In the behavioral sciences, what behaviors are changed after such experience? What behavioral mechanisms account for such changes? In terms of biological psychiatry, how do factors such as personality, genetics, personal intention, spiritual orientation affect the likelihood of these experiences? In neuroscience, what are the pharmacological and neuronal pathways in brain that are changed during and after such experiences? So I think with the progressive lifting of the restrictions on doing work with these compounds, further research is surely going to reveal some of these underlying biological and behavioral mechanisms of action. And I would think it's really quite likely that it's also going to result in an array of therapeutic applications with various creative therapeutic targets. But what I think of as more importantly, these mystical experiences or peak experiences, transcendent experience, whatever you want to call them, appear foundational to our ethical and our moral understandings. They're really fundamental to this basic impulse that we have for mutual caretaking and mutual respect. So further research with these substances then may ultimately prove to be crucial to the very survival of our species. Thank you.